what should every woman know about Zika virus here in the United States, or Southwest Wisconsin? Here's what you need to know. First off, we don't have Zika in this country yet, so don't worry too much. But it's pretty easy and straightforward to prevent Zika. So let me give you some understanding about how to prevent and what to do. First, just don't get bitten by a mosquito. So the Zika mosquito is an Aedes mosquito. That mosquito bites from dawn till day till dusk. So you have to protect yourself from getting bitten. Stay inside, air conditioning, fix the screens. First step. Second is, if you're going outside, cover and use mosquito repellent. DEET is best. I know there's lots of questions about DEET, but the EPA, the American College of OB/GYN, everybody agrees that DEET is effective and safe for pregnant women. So, DEET. Sunscreen first, DEET second. That's what you do. And the same goes for your children. There is oil of eucalyptus, lemon, not supposed to be used in kids under 3. Just stick with the DEET. Simple. Okay? So don't get bitten. Now, there aren't any Zika mosquitoes in the United States yet, so don't worry too much. So then don't get bitten by a Zika mosquito. And where do you find them? Central America, South America, the Caribbean. The exact countries that you need to know on the CDC website. Simple. If you're going to plan travel, be aware of where Zika is. Now, pregnant women just won't travel, period, to these areas. Women who are about to get pregnant won't travel to those areas, or shouldn't. However, you don't have to stop all travel to Zika areas. All you have to do is take some precautions. Number one, when you go, don't get bitten by a mosquito. We already talked about that. The next is, if you're planning pregnancy, you have to delay pregnancy after potential exposure. So in women and men, you delay getting pregnant or fathering a pregnancy for 8 weeks after potential exposure. If you were to actually get sick with Zika, then women, they say 8 weeks after sickness you can get pregnant, and for men it's 6 months. Apparently the Zika virus stays in the semen longer than it stays in blood, so men aren't supposed to father pregnancies for 6 months after getting sick with Zika. What's a Zika sickness look like? Well, it's a rash, it's body aches, it's fatigue, joint aches, sore eyes. It's a pretty normal or common viral illness. It happens 2 to 14 days after getting bitten by a mosquito, which may have infected you with Zika. And again, this is going to happen abroad. This is not yet something, July 2016, that pregnant women or anybody needs to worry about in the United States. Okay, so how do you know you had Zika? Well, you get bitten by a Zika mosquito, that has to be abroad, you get the illness, and then there are some blood tests. So there's a blood test to do in the first week of illness. There's a blood test that is a different blood test for 2 weeks to 12 weeks after you've been ill. These blood tests are run by the CDC or by special health departments. This is not a blood test. You can get it drawn at any hospital, but it can't be run at any hospital. And it's not perfectly accurate. It's the best we've got. So you'd have to get involved with a healthcare provider to pursue these blood tests, but they're not so very useful, but they're out there. What happens if a pregnant woman gets a viral illness from a mosquito and thinks it might be Zika? Well, it's going to happen abroad. It's not going to happen in this country. But when you return to this country, it's going to impact your prenatal care. So depending on how long it's been since the illness, in the first week you get that first PCR gene blood test. If it's more than 2 weeks later and before 12 weeks is up, you'll get the other ELISA IgM blood test. So that's they're not perfect tests, but they're useful in figuring out what's the chance that you actually did have Zika. Then, starting in about 18 weeks, pregnancies will be followed with ultrasound. On ultrasound, Zika is marked by babies whose heads and brains grow slower than the rest of their body, and sometimes there are calcifications or little spots that we can see on ultrasound in the brains of affected babies. Typically, you'll start that ultrasound at 18 to 20 weeks, and every 4 weeks, 1 month for the rest of pregnancy will follow growth and growth of the baby's head to monitor these pregnancies. Unfortunately, today, July 2016, there's no treatment for Zika, so even if the baby or pregnancy was affected by Zika, there's no medicine, surgery, there's no cure, it's just surveillance. The recommendations regarding breastfeeding and Zika are basically to continue breastfeeding. As far as we know, there's very little Zika virus that goes into the breast milk, and the benefits of breastfeeding are still considered to outweigh any risk, which is very small, of Zika. Remember, Zika is a problem for babies when they're in mommy's belly, not babies when they're in mommy's arms.